Bad breath. What are you going to do? How far do you know the cause of bad breath and how to manage it? Today, we will learn how to prevent bad breath with healthy oral care. 1. Dry mouth. Dry mouth, medically termed as xerostomia, can also lead to bad breath as saliva's natural cleansing action is inhibited. Certain medications, salivary gland issues, or continuous mouth breathing can cause dry mouth. To counteract dry mouth, stay well hydrated, chew sugar-free gum or use a saliva substitute to aid in saliva production. Limiting caffeine, which can dry out the mouth, is also beneficial. Both alcohol and coffee can cause a dry mouth, leading to bad breath. They reduce saliva in the mouth, leading to a dry mouth. Drinking alcohol and coffee in moderation or cutting them out entirely can help. Staying well hydrated by drinking plenty of water can also alleviate dry mouth and bad breath. 2. High sugar diets. Consuming a diet high in sugar can contribute to bad breath. Sugar is food for the bacteria that cause bad breath. By reducing the amount of sugar in your diet, you can help prevent bad breath. Regular dental checkups can help monitor and advise on dietary habits beneficial for oral health. 3. Poor oral hygiene. Insufficient brushing and flossing can leave food particles in the mouth that decay and cause bad breath. It's crucial to brush at least twice a day and floss daily to remove food debris and plaque trapped between teeth and on the tongue. Utilizing an antibacterial mouthwash can further eliminate bacteria that cause bad breath. Regular cleaning of dentures or dental appliances is also paramount. Moreover, replacing the toothbrush every 3 to 4 months is advisable. A regular visit to the dentist for professional cleaning and oral examinations can aid in maintaining good oral health. 4. Health conditions. Certain health problems, such as sinus infections, liver disease, or kidney disease, can be associated with bad breath. Diabetes, gastric reflux, and some metabolic disorders can cause a distinctive breath odor as a result of chemicals they produce. Regular checkups with healthcare providers are necessary for early detection and treatment of these conditions. 5. Gum disease. Advanced gum disease, or periodontitis, can cause persistent bad breath. This is caused by an accumulation of plaque on the teeth, which can be managed with regular professional cleaning and careful oral hygiene. Regular dental visits are crucial for early detection and treatment of gum disease. There are many other reasons. Some foods, such as onions, garlic, and spicy foods, can result in bad breath. After these foods are digested, their breakdown products are carried in the blood to the lungs, affecting the breath. Brushing, flossing, and mouthwash might mask the odor temporarily but won't eliminate it entirely. Avoiding these types of foods is the most effective method for prevention. Smoking and other forms of tobacco intake are significant contributors to bad breath. They dry the mouth and leave a stale stench that lingers even after brushing the teeth. Besides causing bad breath, tobacco use can stain teeth, irritate gum tissues, and exacerbate oral diseases. Quitting tobacco is the only viable solution to prevent these problems. Seeking advice from healthcare providers can offer support and strategies to quit smoking. In all cases, maintaining good oral hygiene and regularly visiting the dentist for checkups and professional cleanings are crucial steps for preventing bad breath. Thanks for watching.